Hi, I'm Nick Crowninshield.
And I'm Katie Pelland.
We're the public health nurses at the Norwood Health Department.
And we're here to talk to you about COVID-19 home testing. What is a rapid at-home COVID-19 test?
These are over-the-counter tests that look for parts of the virus in the body.
What reason should I use a rapid at-home COVID-19 test for?
These tests are a convenient way to see if you have COVID-19 when you have symptoms, and these tests may also be used as a screening tool if you do not have symptoms and plan on attending a gathering or seeing a vulnerable loved one.
What reason should I not use a rapid at-home COVID-19 test for?
Since these tests are not supervised or done by a healthcare professional, they are unlikely to be accepted when testing is required, such as for sporting events, travel, or other specific employer or school policies.
How should I use a rapid at-home COVID-19 test?
There are many different brands of rapid at-home COVID-19 tests. Be sure you read the instructions on the box before purchase or use, as there may be reasons why the test is not appropriate for you. Some examples include being too young, frequent nosebleeds, or having a facial or head injury for some brands.
What should I do if my rapid at-home COVID-19 test is positive?
You should isolate or separate yourself from other people. Beginning the count the day after your symptoms started, or the test day if you do not have any symptoms, you should isolate for 5 days. On the 6th day, if your symptoms have resolved or you never had any, you may exit isolation and should strictly wear a mask for the following 5 days. If you do not feel your symptoms have improved, then you should extend your isolation 1 day at a time until you do. If mask wearing is not possible for you, you should isolate for 10 days. If possible, try to obtain an official test by calling your primary care provider, going to mass.gov/gettested, or calling 211 so that you may have documentation of having had COVID-19. This documentation may be beneficial in the future.
What should I do if my rapid at-home COVID-19 test is negative?
If you have no symptoms, it's unlikely that you're currently infected with COVID-19. Rapid at-home COVID-19 tests are an important screening tool for us to have, but no test is perfect, so still consider wearing a well-fitting mask if you're attending a large gathering or visiting a vulnerable loved one. If you do have symptoms, it's possible to have a false negative test and may still have COVID-19. You should separate yourself from other people and contact your primary care provider to discuss your symptoms and whether additional testing is recommended. Testing is a critical part of stopping the spread of COVID-19, as is wearing a well-fitting mask, social distancing, and hand washing.
However, the most effective tool at stopping the spread of COVID-19 is vaccination. Please go to vaxfinder.mass.gov, the health department's webpage at norwoodma.gov, or call 211 to find locations for COVID-19 vaccines and boosters.